We're joined by Dr. Camila Forkash-Levant, a licensed practicing psychologist, organizational consultant, coming to us from Jerusalem. Good to have you back on the show. Look, first of all, I understand these are diabetes drugs, okay, that make you feel low-grade sick even by a lot of people's account, to sort of stop eating. Look, first of all, good drug, bad drug. Where do you see this falling in?
Originally, yes, it's theoretically very helpful because for some people it is really difficult to lose weight, and their level of obesity, let's say, is so high that it's creating a lot of different systems malfunctions. Yes, so for sure, that's a very good thing in terms of having another option. The question is of like, at which point do you start to have such an intervention, and also is it also misleading us in some ways on what it means to lose weight, and also keeping it off, right? Like in general, how we view weight and how we view different shapes of body, and like what is it? A lot of it is cultural, yes. So like how do we view beauty? What is not healthy, and what is something that's just perceived as not attractive? So there's so many questions that are like a whole debate.
Right. I mean, it's leftist questioning, should weight be considered the most pressing health issue, or probably heavily dependent on what society you're in, or is it just cosmetics? Is it vanity? I mean, where does that become, on a case-by-case basis?
So that's the thing. I think that we do have a medically clear, mark where it does become unhealthy. And of course, it also depends on who the individual is and how does your specific body function, and what's the environment that you're in, how stressed you are in general, because the more variables you add in, like on anything else, the more variables you add to this side or to that side, right? The more likely you are to be like healthy or unhealthy or happy or not or whatever, right? So like everything is mathematics at the end of the day in some ways, right? On the other hand, though, there is the cultural overlay. Like let's say if a person is beyond a certain weight, and we do see that is a contributing factor into whatever else statistically they might be suffering from, then yeah, it would be nice if we actually have something to help them in a quicker way, which this medicine offers, right? On the other hand, if it's below that, or even if a person is overweight, let's say mathematically, yeah, but they're still okay, they're healthy, so they're healthy, that should be their choice of what it is that they want to do or not want to do, right? Then there is, of course, the cosmetics part. Like culturally, what we see is beautiful. So also we shouldn't be necessarily against that too. Like if a person wants to lose weight or do any cosmetic procedures or whatever, taking care of yourself, right? That also should be your view of what it means for you individually to take care of yourself. For example, right, people often look funny at different cosmetics procedures, right? But it's like we do go to hairdresser to cut our hair or whiten our teeth or fix our teeth. Like how many of us do not have fixed teeth? So why not be natural with no teeth? Yeah. So like there is degrees of this, and of course, if it goes to a part where now people are doing surgeries all the time, and all of a sudden they don't look like themselves anymore, could also get dangerous. So like everything else, right? Like we'll go back to OCD or something like that. Like washing your hands is a beautiful thing, but if the skin is falling off.
That's right. You're right. The priorities have changed from decade to decade, century to century. But we're bringing in Dr. Rodit Adler, the president of the Israeli Forum for Sustainable Nutrition. Thanks for joining us here to this. Look, what is the situation in Israel? Are these drugs that we discuss here, these weight loss drugs, are they widely available? Are they being used? Is it an issue here?
First of all, it's a huge issue. As the Minister of Health has mentioned a few years ago, the first cause of mortality and death in Israel is unhealthy diet and obesity. So it's a huge problem. And we know that diabetes is also on the rise in Israel. And unfortunately, we're even leading in amputation from diabetes among the OECD countries. Even though we have a great food health system.
There's this other angle, the celebrity angle here. I mean, we have figures like Elon Musk, the Osborne family members, Oprah, Jessica Simpson, just some of the people that I came across in my research on this. What is about the celebrity appeal? Does it speak to the drug's success, or is this one of the dangers associated with this?
I would like to refer to the bigger picture. We're in the midst of three huge crises: obesity and diabetes on one hand, nutrition insecurity and hunger, even in the richest country in the world. On the second hand, and the environmental and climate crisis that hit all over the world. You know that in the United States, they are not going to insure houses even because of fires and high rockets temperature and so on and so on. We are coming to a global food crisis. And now we're talking about a disease, which is basically a nutritional and a toxic food environment disease. Do you think that there is any country that can treat all the obese people for life? You know, in the United States, they cannot eradicate for decades nutrition insecurity. Now we are coming to a situation that on one hand, the global economy and even the richest countries are incentivizes in immense toxic food environment, which really hurt us in any point of view and angle. And we are looking for a medicine that will make rich one or two countries and all the rest poor. There is no way that this medicine will solve the basic cause of the problem. It is good to have some kind of medicine to help treat, but in order to treat obesity, we need to change our toxic food environment and our food systems. That means we have seen in Israel, we gave a small tax on sugary beverages, which really gave great results.
And warning labels, the warning labels are a new thing, the high sugar, high salt content, high fat content warnings.
That means, listen, it's unbelievable that now the Danish economy is really lying on one pill to treat a disease which is really a cause of our making, yes? And unfortunately, when you interview any kind of a clinician, please ask them, do you have any kind of a conflict of interest? Who pays for all this research that you are doing? And I'm not referring, the medicine itself can be efficient for a while, but we know that if you stop it, the weight gains back. And unfortunately, many of the people who use it sometimes do not get the expected results, and it even make the vicious circle even much harder. That means we have here a huge problem that we need to tackle the basic of it. We need to make a transformation of the food systems, and if we do not do it, the humanity might not survive. We must understand it. And this is just a reflection on one angle of it.
Dr. Rodit Adler, appreciate your time. And of course, the warnings to us all, be conscious about what we're putting in our bodies. Dr. Camila Forkash-Lavon as well. Thanks for joining us on this, giving us more insight into the psychology around it as well. Thank you both.